Hello and welcome to another episode of the Melbourne Athletic Development Podcast. Jack?
John?
Building on our recent podcast looking at youth sport development, the question came up during it that we wanted to actually address in its own separate podcast, which is basically resistance training for youth, because it's always a question that we get asked. And it gets asked quite often of like, should kids be in the gym? And if they are, what should they be doing? And there's lots of commentary around it. You know, things like it'll stunt your growth, it'll cause injuries, it'll make you muscle bound, it'll make you slow. And I thought it would be a really good place for us to actually jump in and maybe give a little bit more information about that, some of the research that's behind it, some of the literature, and basically give people who are navigating that space, because we get a lot of parents who come in with their kids, they're participating in sport, often at various different levels, some, just getting into it, some at a really high level. And for those who know, like, we obviously provide strength and conditioning services, and we're willing to do that in the youth population as well. So we will have to say that, it's clear that we have a propensity towards thinking that it is useful. That's a position that we take straight away. But maybe we should go through the idea of how we think it can be useful, and if it is, what things are important to focus on.
Yeah, and I think two other things to add to that is understanding like where you start, because I think, just saying that resistance training is effective for youth development doesn't mean you're going in and doing, maximal squatting, so to speak.
Why not, Jack?
Well, we'll get to that in a moment. And I think the other one with that then too, which ties into the conversation we had about thinking about increasing someone's ceiling through having diversity in their training stimulus through their development, is looking at resistance training in a similar way, because ultimately that's what you're trying to do. You're trying to develop a base for which then they can start to accelerate the development of certain physical capacities and let that support whatever particular sport they start to then specialize as they get into later adolescence, early adulthood.
Well, I think the good thing is, we should probably talk about this as well for general health, not just for sport development, because I think that there are some really important key aspects that you can apply to get improvements in not only your immediate health, but potentially your long-term health from the application of, resistance training or getting into the gym. Yeah,
it's actually, that's probably a conversation to have by itself, because I think often the time when we do a podcast, there's always the association that, they're talking about elite athletes. But the reality is the majority of people we still see are in the general population. And a lot of the principles do transfer either way. I mean, I think the differences between an elite athlete and the general population is more just nuance than as opposed to like significantly different principles.
Yeah, but I think, we obviously had a conversation recently with David Bem, and he was really clear to point that out in terms of especially the research, like the application of an intervention to an untrained population or someone who doesn't necessarily have a significant background in, a particular sport or a particular intervention or training area. The outcome might be different, and so the way that you have to apply the stimulus may change. But effectively, they still will have a similar signal that goes through to, your tissue.
Yeah, so, I mean, before we get too off topic, let's be more specific to the topic of discussion today with regards to youth development. I think a good starting point to think about how resistance training or work in the gym helps support the development of a child or adolescent is two things. One, the actual skill itself of learning particular movement patterns, which again feeds in very much to the conversation we had the other week about having diversification in the types of sports that you play. Because the reality is, even if it's something as simple as doing an overhead squat or doing a push-up or learning to do a pull-up, whatever it may be, those are skills that do require your body to develop the appropriate coordination to maximize your performance in that. And I think one of the other things too with that, and this probably ties into, I think, the other reason why you then apply resistance training is working on the tissue capacity, the overall physical tools that an individual has to then support the demands of the biomechanical requirements of the specific sport we're referring to. And I was going to say, tie in with those two things. One of the great things about when you're starting young is you don't have to overcome some of the issues that develop the older you get, particularly with restrictions in movement or flexibility. Because I that's something I know I've talked about before, but I think flexibility is such an important foundation for good movement. And it seems that flexibility is inherently high in us. We lose it over time.
Yeah, I think that's a really important thing to highlight is most people will recognize as a younger person, they were more flexible.
Oh, absolutely. And this is it's one of the things I think about when we might work with an individual who has an injury or back pain or whatever it may be, and they're in early mid-adulthood with very little or no training history, is your ability to actually work on, say, building up their force capacity, their strength, is limited by the range that they have, which by that point might be actually quite limited or difficult. And it's one of the things that is such a valuable thing for working with adolescents or children, is it allows you to make sure that they can maintain force-producing qualities through a very large range. And that is such an essential tool from regards to a performance standpoint, because it makes sure that in certain positions, and you got to remember that when you're playing particularly those more wicked type of sporting environments where the positions, the angles, the directions you have to be in are very complex, they're very broad, they're very diverse, and having that movement, having that flexibility and developing that strength through that large range allows you to be able to deal with those very unexpected forces in very unexpected positions.
Yeah, and I think that feeds into the discussion we had with Jake Cowan about the influence that movement variability has on overall development of skill and improving expert performance, and knowing that you need to have enough variability in what you do. And so as a starting point, I think the point that is really clear from what you're saying is introducing younger people to the gym environment is a way of exposing them to new movements and variability within their movement.
Yes. And I think it's also worth just clarifying too that when you're introducing youth, because this may be starting with relatively young kids, you might be even at the ages of, say, 10 to 12, introducing them to a gym environment. But that may be something as simple as, okay, we're going to teach you to do a squat with a stick. And I think that's often where people sometimes get confused or concerned about that. It's like, oh, what, you're going to start putting all this weight on my child's back and applying high physical loads. Well, eventually you're working towards that, maybe not necessarily high loads, but this is just about, can you actually develop and demonstrate good movement patterns associated with a squatting technique? With a jumping technique, with a split squat or a lateral squat? Can you start to coordinate that into more complex high velocity movements? And that might be introducing them to things like weightlifting derivatives, doing things like a snatch or a clean and jerk. Because these require certain physical movement patterns, which again feeds into building up that movement quality and movement literacy and exposing the neuromuscular system to new patterns of movement, in addition then to starting to create the ability for that individual to produce forces in certain directions, in certain complex patterns.
And I think, it is a fear that a lot of parents have because of the preconceived ideas that are out in the general sphere of sports performance. Why do you think that those fears exist? Do you think that they're justified? Do you think there is historical kind of evidence that people have, pushed kids too much and developed injuries and things? Or do you think it's, some of the literature potentially not being well enough developed to be able to comment and inform on that at a high enough level?
Yeah, I wonder if a lot of it has to do with, for youth development, the skeletal system in particular is immature. What I mean by that, it's still going through development, and it's obviously going through rapid development. And that can be associated with an increased prevalence in injury
Yeah, most people would be aware of that. As if your child goes through a growth spurt period, or you may remember back to when you go through a growth spurt period, it's such a variable environment for you to be able to navigate, or the child to be able to navigate, that they often do present with overload to particular tissues, whether that be bony tissue, tendon tissue, some sort of muscle, even generalized growth pain.
Yeah, and I think the thing people need to understand that typically is due to a training error, or particularly too much training density, and that will often fit into the child or adolescent who, again, is specialising and is training 5 days a week and playing 2 or 3 games on the weekend. Or at the same time too, even if they have diversity, but they're still doing, soccer on a Monday, swimming on a Tuesday, Thursday, footy on a Wednesday, and the overall density of their training is too much. Because you have to understand and appreciate that through a growing child, there is very high metabolic demands already in place because of the requirement to build new bone and soft tissue, let alone the energy expenditure associated with training itself. So you can't forget about the fundamentals of making sure that you program training stimulus that's appropriate to the individual's current physical capacity and their training history, and not to mention taking the other considerations like the high metabolic demands of growth.
Do you think any of those sort of general, I'm gonna use the word myths, because I don't think any of them are clear factually or proven in any way, but any of those myths are justified? Or are there any, I think the key ones are that, you're going to get muscle bound and stiff, you're going to stunt people's growth.
Yeah.
Do you think any of those actually have any validity and they can be argued at a level that is reasonable?
From what I understand, when you look at, say, group cohort studies that are looking at resistance-trained youth versus non-resistance trained, you don't see a disparity in average development.
So there's no to clarify, there's no real evidence that that's the case.
No, there's not exactly. And I think
there might be individual cases where people may have developed injuries or whatever from being exposed to that, but that's probably more related to the way in which that program has been implemented rather than the modality itself.
I was going to say, I think what's probably important to look at there is what specifically they were doing. Because again, and it's really important to highlight this, the introduction of resistance training to a child or an adolescent is about just building up basic movement qualities. Where it's not about going, all right, we're going to get you squatting 2 times your body weight in the next 6 months. Look, the reality is if you do apply effective resistance training programming over several years, it may be that they get towards their late adolescence and doing that. But that's late adolescence. That's when you're getting to a point when you're able to tolerate those stresses.
In your mind, how quickly do you think that these things should progress? And is there an element of having to hold back youth through this process?
I think it's important to, again, not to specialize too soon. That's a really important thing. That remember, resistance training is a useful tool to help support the overall physical development of a child, but we have to make sure that that doesn't become their sole focus, and that they're in the gym training twice a day, every day of the week.
Yeah, it's funny you say that, because one of the things that I've thought about a lot with that is part of the reason that you start to go into the gym for some of these younger athletes, or even just younger people in general. Say, for instance, they're not even really an athlete, they're just a young kid that participates in general physical activity, and they're starting to notice they're getting discomfort or whatever through their growth period. It's actually to eliminate factors that are negatively influence their ability to participate. And what I mean by that, say, for instance, if it is an athlete, if they keep getting injured because clearly they lack a certain characteristic, then part of your role with using this type of modality is to get that to a level where that is not a limiting factor for them. It's not to maximize that factor. It's actually just to allow them to get to the point where I can participate and I'm not worried about injuring my knee, or I'm not worried about getting, irritation of my tendons, because I actually have enough physical capacity to deal with the stress of running around the footy field or whatever it is. And unfortunately, we seem to see and this is why I think it's actually almost becoming a bit more popular and almost a bit more useful, is younger kids are less active than they previously were, right? And that's no fault of their own. There's plenty of things to do now. But it means that when they do go out and participate in organised sport, they actually don't have some of the underlying physical qualities in order to support that. So we often, as physios, will get these kids come in, like, oh, my knee's been hurting. And you have a look and you realise very quickly, okay, they're getting maybe patellofemoral pain, or they're getting some irritation of, a patellar tendon or a apophyseal type issue. But when you put it in the context of why that's happening, it's because, as you said, their movement quality is not great. They really lack even just fundamental strength through range of motion. Like, you ask them just to do a bodyweight squat and their knees are moving all over the place and their hips are shifting and they can't maintain an upright torso position and all those kind of things. And you think, actually, you even don't have the foundational, say, strength qualities to just move effectively, let alone adding any resistance to that. And then you try and go play footy or cricket or soccer, and then those, your body starts getting overloaded. So part of the role of introducing younger people to this is to actually bring them up to up to the playing field, to the level that means that they can participate without actually being restricted.
Yeah, and I think that really highlights here too that hopefully a child's being involved in different sports and physical activity, they're building up particular movement qualities and overall capacity and skill sets. But again, it's about how you support the individual through making sure that individual physical attributes, flexibility, strength, endurance, max strength, power, elastic function, are there to support what their system is trying to achieve in the particular sport or task that they're doing. And again, it's the same principle that we apply in anyone, whether they're a child or an individual or an adult, is we are very good at finding strategies to complete a task. So, whether it's a kid, whether it's an adult, whether it's an elderly person, you expose them to a new sport, a new task, they'll figure out a way to do it based on the tools that they have. So you have to understand that for a child, they'll start to refine how they move to better complete a task more effectively and efficiently. But then that can then reinforce that they only use, say, a particular range of movement, or use a particular area of their body in terms of strength qualities because they have a preferential bias to that. And that's where something like resistance training comes in, because it ensures that you maintain diversity in the individual regions of the body. And that's probably actually a good way to explain it, because you get a kid to do a sport, their overall system will figure out a way to complete it. The great thing about resistance training is it allows you to break down individual regions and go...
Well, on that, that's a good one, because one of the things, and it's sort of like the first thing, and it's usually young males who want to get into the gym first.
Yeah.
But the first thing they go and do is they start doing, biceps and triceps and these body part splits. What's the sort of idea behind how you actually put together a training program? Because a lot of these younger people will start to want to get in there, and there is always this argument about, do you develop regional specific, strength qualities and maybe some hypertrophy, some muscle growth, or are you better off kind of exposing them to much more holistic and combined movement patterns? Say, pushing, pulling, different tasks.
Yeah.
What's the ideas around that, and what are some of the things that people should be aware of if they start exploring these different methodologies?
Yeah. Well, look, to begin with, I think it's more useful to think about doing more complex whole body tasks, because again, a part of this is making sure that they can develop effective movement patterns, that they can move through a large range. And remember too here, particularly when you're dealing more with like children, it's not about developing or applying lots of resistance to begin with. It's about making sure that they can move through their main joints in large ranges. And there is that question then of like, well, how do you make sure that one region of the body doesn't dominate the movement. And that's where you try to create constraints in how they do the movement to ensure that there's effective...
select tasks that will balance those things out.
Yes, because remember too, and it's important to make that distinction between, like, say, particularly prepubescent and postpubescent or during pubescence, because most of the adaptations are going to get predominantly neurological. And
what do you mean by that?
What I mean by that is that most of the adaptations are happening through their central nervous system, so more to do with the, if you want to put the brain essentially, and how the brain creates electrical signals to the muscles to create effective coordination, synchronization, even things like maximizing motor unit recruitment, and even things like then tied in with that firing frequency. So it's just about essentially making sure that you are maximizing the utilization of your nervous system and how that interacts then with the muscular system being able to create force production.
You mentioned obviously, the difference between pubescence and prepubescence. What actually happens there? Why is it that, they're going to be different, and why might you see different changes occur from the same or similar application of resistance training?
Yeah, and so this has to do with the change in the hormonal environment in particular. So when you're going through pubescence, you're going to get a large change in your hormonal profile. So, and that's when you'll start to see, and this is quite clear when you look at the literature, for prepubescence, looking at females and males, there's actually very little difference.
Not much difference, yeah.
Exactly.
And it's funny because you actually see very similar performance capability prior to pubescence as well.
Yes.
Often, like, say, for instance, in sport that we work a lot in track and field, the difference between a 10-year-old male and a 10-year-old female in terms of, say, running performance is not that significant, or an 8-year-old. It's actually a lot closer than when they get to 16.
Yes. Yeah. And then with that change in environment, we know that hormonal factors play such a large role in the anabolic signals to the whole body. I mean, like, we're talking obviously in particular about the musculoskeletal system, but it's not just simply that. And that's why you see on average specific anthropometric and physical differences between males and females in terms of looking at stature, like height, strength, and so on.
Yeah, bone density.
Yes.
Well, I think that nicely leads in. I don't know, we will talk about this probably in a more general discussion, but specifically in relation to use and resistance training. Like, what are some of those benefits that you get for the application of that might be more systemic and maybe related more to health than they are necessarily to the performance side of things?
Are you talking about in general here, or are you talking like when you're getting to pubescence? Or
I'm saying in relation to starting training in a resistance setting from a young age, are there health benefits that you get both at the time and in the long term that are actually an advantage by starting at that younger age versus older? Yeah,
look, absolutely. I mean, the best example of that, I think we might have mentioned this in the previous podcast, but the most well-studied one is looking at bone development, particularly in females, because we maximise our bone development by the age of, I think it's about 25.
Yeah, I think that's around that sort of mark.
And
so basically what that means is from 25 onwards, your bone quality is generally decreasing.
Yeah, it's actually interesting. There is some research showing that we can actually improve certain qualities of bone strength post that, but certainly, and again, makes sense when you think about from the ages of 12 to 20, that's when we see the largest physical development of anyone, of any individual, typically speaking. And bone is the same. Bone is responsive to the anabolic, the hormonal environment, and also to the mechanical stresses, particularly during that development period. And that's something that you do see differences in males versus females, particularly for females postmenopausal, where that hormonal change in their hormonal environment is associated with an overall net loss or degradation of their bone system. So that is, they'll start to develop weaker bones. And that's why you see osteoporosis as being much more prevalent in females versus males, particularly postmenopausal. But there's a lot of good work looking at how we can essentially maximize our bone reserve. So that is how much bone we actually have in our skeletal system. That then determines how far you can fall before you start to run into pathological situations like osteopenia and osteoporosis. And this has to do in particular with not only developing things like bone mineral density, but even looking at the geometric layout of the bone, where it increases the overall radius too. And that's an important thing that people need to understand, that absolutely bone mineral density is very important, so i.e. how dense the bone is, but the actual shape of the bone is as well. Because if you have a larger bone, typically when you start to get bone breaking down, it will break down from the inside out. So it means that you have an overall larger, like a lever arm from the center of the bone, which is associated with an improved strength quality. And this is exactly what you see in all of us as we go through bone degradation, but it's particularly important for females because it essentially allows you to have a larger bone, so that even though as you start to lose density as you get older, the actual geometry of the bone still allows you to have good overall bone strength. And that's a really important thing to highlight because, and there's a lot of people that talk about this now, that when we talk about bone strength, people often associate it purely with bone mineral density, which is a really important factor, but it's not the only factor. Like there's also, again, thinking about the shape of the bone, and then there's also quality factors as well in terms of when you think about things like collagen types in it as well.
I think that's like one of the key ones is, and we spoke about this from a neuromuscular development point of view, but understanding, and it's not the only thing that will develop bone. You know, obviously any ground-based activity that involves running, jumping will actually have an influence on the development of that bone reserve, as you mentioned.
And just actually on that point, something I was going to mention before we go on is people's concerns with resistance training. I think it's important to remember that the magnitude of forces that children are applying to their body by playing footy, playing basketball, they're very, very large magnitudes of forces.
Yeah, much higher than what they would get in a resistance training setting.
Yeah, absolutely. So I think it's important to keep that into context too, because, you know, even when a child's getting to a point where they're maybe putting just even a little bit of weight, like a barbell on their back, the actual exposure of mechanical forces at the muscular or bone level is still pretty small relative to some of the ground reaction forces you get from sprinting, change of direction, jumping. And so I think that's an important thing to remember.
Yeah, I feel like that's often missed because people don't realise that, them doing those tasks might be many multiples of their, a jump task might be 4 or 5 times or more of their, their body weight actually going through a particular joint, in their leg, compared to if you do a squat. Yeah. It's only really your body weight. If you add some resistance to it, even if you add your own body weight on top, it's only 2 times your body weight that you're actually moving through, say, your tibia or something like that. Whereas if you jump out of a tree, which kids do, that might be 8 times the force going through their tibia.
Yeah, absolutely.
Those things are important, I think, because what it highlights is by exposing people to this, that there is actually long-term health benefits that can be, maintained. And it's something that I don't know that people are that aware of until they get much later in life. And I think that there's an interesting, particularly around bone, there's something really interesting about the use of resistance training for people who participate in sports that have a very high endurance base, that it actually helps you to maintain your bone density because those endurance tasks often actually don't help with that.
Yeah.
Particularly as, we're seeing a lot more of it or at least I'm seeing a lot more of it, younger kids in, cross country, in distance running, even in, footy and soccer and all those things, training with much more volume. And our propensity in Australia culturally is to use a lot of endurance training as part of the preparation for that. Those things can actually be quite deleterious on things like your bone mineral density and the bone laydown that you get.
And I was going to, just to support that, if you look at sports with the highest amount of stress fractures, it's cross country is up there.
Yeah, it's distance running is probably the highest. I think if you look at the prevalence statistics. And the reason for that is not just because they're doing a lot of loading on their bones, it's because the task itself actually is a signal to the body of like, how do I reduce some of my, mass?
Yes, exactly. Because, and again, this becomes more prevalent the more you start to specialize in, say, an endurance task, is it's about developing metabolic efficiency. So it's not about providing an anabolic stimulus, so that is to gain more muscle or bone, because that's associated with more mass. And the reality is I don't see any elite cross-country runners who are,
Look like the Hulk, yeah.
Exactly. So it makes a lot of sense when you think about how that influences your hormonal and chemical signaling in the body, and the influences that has on the integrity or strength qualities of your musculoskeletal system.
If it's applied appropriately, and we say that's, it's done gradually, it goes through that idea of, building movement literacy first, there's the intensity and the density of it is not inappropriate. Are there any negative effects that you can get from resistance training for youth, whether it have, as you said, on the metabolic systems, on the hormonal systems, on the musculoskeletal system itself?
Oh, well, I think quite the contrary, actually. Like I'm trying.
Well, that's why I ask it, because I don't actually, off the top of my head, I can't think of a negative that comes from it. In fact, all of the outcomes that you get, if it's applied appropriately, are positive. And the risk of injury in a controlled environment, especially a coached controlled environment with resistance training, is actually a lot lower than what you see in most other sports.
Yeah, absolutely. And that's actually a good thing to highlight. Because I know, and you see that again a lot in the weightlifting literature for youth development, where, again, it's something I haven't really thought about or gone down or thinking about, where have some of the myths around youth development come from exactly, because in the right environment you would see exactly the opposite, because apart from, for instance, improving the overall development of a youth athlete, and that could be related to sporting endeavours but also just their overall physical health and well-being, we see that it helps at a level of the bone system, the muscular system, and then even moving on with thinking about how that can, associated with that very strongly is how that can support things like your hormonal system, and even seeing correlations between like organ sizes and things like that in a positive light. And thinking from a health perspective, one of the best things you can do to mitigate the development of any disease, particularly chronic diseases, is muscle mass. And again, this is all about the appropriate timing within youth development, because to begin with, it's not about, all right, we're going to get you massive. But anyone, whether you're 10 or 40, if you have no training history, you have to typically start at the same point. You're not going to be saying to a 40-year-old with no training history, just because you're an adult, we're going to start getting you to do heavy squatting. You still have to go through the same process of, I'm going to have to teach you how to do these movements effectively, and preferably through a large range, but that also might be limited because there's only so much time or so much you can reverse in terms of poor flexibility. But you still have to go through that same process of building them up so that before you then actually start to apply an external resistance to a particular resistance training movement.
With that in mind, you mentioned muscle mass. Is there difficulty in managing the development of muscle mass in this population? Do you think that there is an issue with it where one of the common myths is, someone will become muscle bound and it's going to affect, say, their sport? Do you think that that's justified in any way?
I think the issue that might come up is if you don't have the appropriate person coaching them to do movements through appropriate ranges, because I think probably a lot of particularly teenage boys might be guilty of, like you were mentioning before, doing too many bicep curls and just thinking about how much pump they can get, and then forgetting about important training principles of, one, moving through large ranges. And I think that's a really important thing to highlight, that resistance training through large ranges improves your range of movement. In youth, when they've still got good flexibility, it will help maintain that, ensure that they can produce force through large ranges of movement. So for me, if you do see that that's a limitation of the individual, like the person's training program, that they're not actually moving through a large range, and in addition to then making sure that they do things like stretching to ensure that they maintain good compliance to their soft tissue system. So although that can happen, I think that's a limitation of the training program or the coach that's working with that athlete to ensure that they don't start to get some of the negative side effects that can be associated with moving through small ranges.
I don't know if we've spoken about this before, but do you think there are issues of exposing people to something like resistance training early on in their, say, sporting development? Because it is in lots of ways a unique training stressor or training stimulus, that it actually takes away an opportunity in the future to be able to add a novel stimulus.
You think adding it too early maybe?
Yeah, where it's like, you're using up your bullets too early. You know what I mean? Like you're not actually saving it for a time where, and this is more talking about performance, not, we're kind of slightly shifting the discussion here. So sorry for the tangent, but do you think that there's ever a time where you think like, actually we should save that because at the moment they're not being restricted in what they're doing and they're developing well, and that's going to be a nice stimulus when we feel like that performance improvement is slowing down?
The thing I think of is resistance training and working in the gym allows you to then break down specific region development, and like we were talking about before, whether that's doing more simple type of movements or whether it's actually creating constraints so that they emphasize movement in a particular part of the body when they do a more complex whole body movement. So I guess my only concern with that is if you are just focusing more on doing skill development and focusing on doing a particular sport or even maybe multiple sports, you're going to trying to develop efficiency with how you move. And I wonder if that then starts to
close that window down.
Yeah, exactly. And start to go like, well, I know I can jump really effectively by just moving through this particular range. And so you develop and maintain really good stretch shortening cycle in that range. But then when you put in other environmental situations that require you to go a little bit deeper or a little bit, they have shorter contact times or whatever it may be, is that when you then potentially run into problems and increase your risk of injury. So I guess the other question then comes to, and this is probably a good question for you to answer, is, you talk about the novelty of a training stimulus. How much do you expect resistance training to move the dial in someone's performance? Now, it probably depends on the particular sport here, I guess, too. But maybe it's one of the, if we maybe use an example, think of, say, rugby, right, where there's obviously a lot of skill, but clearly having certain physical attributes is very, very advantageous. And the reality is, if you don't have those physical attributes, there's always going to be a limit to how far you can go. And, it seems counterintuitive in that situation to go, well, we're going to delay resistance training to you until you're 21, because then there's a lot of catching up to do. And by that point, you
might be too far behind.
Exactly. You may have developed some great skills, some speed, but, the reality is it's
getting smashed because you're tiny.
Yeah, exactly. But it's probably an interesting question to ask with something like sprinting, because I know I've spoken to you before, and I know that a lot of coaches question whether something like resistance training actually has a lot of translation to, say, sprint performance, which I think makes sense, particularly when you think about really high velocity running. Maybe with acceleration it perhaps has more transfer, but perhaps when you're starting to actually transition from that first few steps to then moving into higher speeds, I would expect to see less translation.
I would say that I think it comes down to specificity. So I think the trick with this, with not using up, say, your best bullet, is that the fact is you're not getting too specific too early, but the general benefits are there. and this is obviously more related to the performance question, which kind of goes off topic a bit, but my general idea with why people's gym translates and doesn't translate is because it hasn't become specific enough.
Mm-hmm.
So early on, the application of resistance training will be a stimulus that improves some of their physical characteristics, and that in itself will be reflected. But if that doesn't keep getting more specific, it doesn't then correlate to the factors that are associated. And the biggest ones, and this is more to do with obviously the nuances of the sport, but what your resistance training comes, and this is the difference between general resistance training and actually what strength and conditioning professionals should do, is the correlation between the biomechanical features of the task you're doing should be reflected in some aspect of what you're doing to create resistance in the gym.
Yeah.
Right. Now, it doesn't mean the movement looks exactly the same. It doesn't mean that you can even replicate some of those things, but the speed of movement is trying to be, in some ways, reflected. The intent of the movement speed is being reflected. Maybe the angles of the joints that you're going through range are reflected in a similar manner.
Yeah.
The key areas of the body that are under the greatest amount of stress need to be stressed in a different way in order to prepare that. So what tends to happen, I think, is people start out in the gym and they'll do, even if it's, say, let's talk about, say, sprints, they'll squat, power clean, bench press, pull up. That's kind of like, a standard program. And they basically do that their whole career.
Yeah.
And nothing really changes about what they do. They start the preseason and they'll do 4 sets of 8, then they go to 4 sets of 6, then 4 sets of 4, then they'll do 4 sets of 2s, and they'll go back to the start and start again. And nothing has ever changed in any of that. They're not focused so much on the speed of movement. They're not really that focused on that getting any more specific to what they're doing. They're not necessarily getting that to cross over to the sport in any very specific way. And that's where now there's some much more advanced ways of measuring things that I think has really crept into the gym. And I don't think that's by accident. One, obviously, it's a controlled environment, so it's easier to measure in that environment. But the other reason is because I actually do think people who work in that space are trying to find things that are going to translate better. And they're trying to say, like, I need to measure the speed of this, or I need to know how many watts this is creating in terms of power, or I need to know the bar velocity, or whatever it is. They're trying to work out, is this going to translate for me?
And I don't want to get too off the topic because but this actually I'll tie this back into the conversation youth development. But just talking about this now, I was thinking about our conversation we had with David Bem about instability training. And it made me think of sprinting, because if you're just doing a traditional back squat, a barbell is a pretty unstable thing to have on your back. And I was thinking about, you could be a really strong athlete who's developing very good, 1RM squatting capacity, or even doing a jump squat, but you still have this very unstable thing on your back, as opposed to like a Kaiser squat type machine where you have a much more stable environment to produce force. And I realize the force is a bit different because you have that pneumatic pressure and it's keeping it consistent. But it made me think about the value of perhaps having that environment that's stable to produce force, having much more translation to sprinting as opposed to a bar.
Well, we find that very much in the sense of like how much, say, force or power they can create. So in those environments where it's very restricted, they can create a lot more.
Yes.
And that exactly speaks to what David mentioned, that as soon as you add some level of instability, now obviously...
And this is again from more the performance side of point.
If it goes very unstable, you're standing on top of a BOSU ball, as you said, you can get a reduction of up to 60% in your force capability. Now, it might not be the same for a standard back squat, but it's going to be something.
It's going to be something. And going back now on topic, I think the valuable thing to talk about here with youth development is you actually want to provide diversity in what they're doing in a resistance training setting. It's not just like, okay, we're going to teach you a squat, a deadlift, and a bench, and that's all you're going to do. This is where you have an opportunity to really even be somewhat creative at times too, but really expose them to lots of different types of tasks that require eventually like dumbbells or barbells or med balls, or to be honest, even doing some instability training too is probably going to have some benefit with exposing them to a novel type of stimulus, because you're not, but this is particularly important through the early stages of youth development, you're not trying to get them to become really efficient at 1, 2, 3 tasks and then add weight. You're actually just trying to expose them to a whole bunch of different movements where there is the ability to be like, all right, well, we're going to change this so that you have to then keep your hand over your head, or I want you to make sure that your knee stays over your toes, whatever it may be. Try and make it somewhat enjoyable for the kids too, because there's nothing.
Yeah, kids want to explore
totally
the physical space and play with that. So it's important to create constraints that are maybe some sort of resistance, but in a way that allows them to explore that movement.
Exactly. And that's with creating differences in the boundaries in which they do the activity, or, adding cones in to create certain movement complexity, whatever it may be. But that's actually a really important thing, because similar to providing diversity in the sports that they play, this is about just the overall development of their neurological, physical system. This is not about going, all right, great, you look like you're a decent soccer player, let's get you good at doing A, B, and C because that's relevant to soccer. It's not so much about that, very much so in those early years of introducing resistance training.
With that in mind, what are some of the variables that you need to be aware of? And I don't want to be too prescriptive with this, but what are some of the things that you think are reasonable for a younger person to start getting into the realm of resistance training or strength training? If they're getting in the gym, it's obvious, I think, to most people, you're not going to say, all right, start doing 6 days a week in the gym.
Yeah.
But what do you think are some reasonable things? And I don't want to get too prescriptive, but what do you think is a good starting point for people?
I think the thing to consider, and we've mentioned one already about ensuring large range of movement, but building on that is thinking about movements of different parts of the body in different planes, I think. And then,
that's a big one, isn't it? Actually
absolutely.
Moving, not everything. I think we do so many things generally in the a forward direction, that sagittal plane.
Yes, and thinking about for the arms and the legs, that we obviously have 3 planes of movement. We can create movement in a pushing or pulling type of activity. We can push in front of ourselves, we can push overhead, we can push down. We need to think about those variables that create different types of neuromuscular patterns. And then think about how we can do that in more complex movements. So like a good example might be a pull-up, or maybe even something, an assisted pull-up, dips, push-ups, just those kind of typical standard movements that
actually, on that, I get asked often, ideas around like calisthenics and those kind of, they're almost like military style training elements, push-ups, pull-ups, handstand type stuff, like body weight squats,
hanging,
lunges,
leg lifts, all that kind of stuff. Yeah.
I often get asked, people say, oh, they're great, everyone should do them, which I'm not disagreeing with, but do you think that that's a valuable entry point for youth development in terms of resistance training? And if it is, or if it isn't, at what point, do you think that you then need to start adding external resistance to that, or do you never have to do that?
Oh, no, I think they're a great starting point, because I think with developing just good body weight strength is a foundation to any youth development program.
I think that's one of the key things, actually. It's funny because I get people come into my training environment, and in all of one of the things that I always make everyone do is pull-ups. And often actually the female athletes, they come in and they've really never been kind of pushed along to do pull-ups, and they can do 1 or 2. And a few of them have asked me, like, but I'm strong. And it's like, yes, I understand, but you need to have some foundational capabilities.
Yes.
That's actually important, as you said, from the movement variability point of view, and even just your ability to control your limbs through space. And I find it quite interesting that you will often get people who can be very, very strong with external resistance, but then when you ask them to do a task that maybe is through full range, like a strict pull-up, they can't do it.
Yeah, and look, absolutely. And again, I think gymnasts are really good examples of that, where they demonstrate the two qualities where a lot of it, I think, has to do with their trunk strength as well. But moving through large range, I think that's the other really important one that people forget about. And I keep going on about it because I see it as fundamentally important, where I think of, like, say, for instance, doing, or a pull-up or a chin-up is a good example, but then like doing like a hanging leg lift, where it's like, should you be able to, well, if you have an effective youth development program, it should be very feasible for a child to be able to lift their legs up and almost bring them up to their head.
Yeah, touch the bar or whatever it is.
Totally, and that might seem like that seems a bit ridiculous. And I see that as a failure of effective development at the right ages, because you're starting it too late and you're exposing them to small ranges. So this literally just don't develop those strength qualities at the inner or outer ranges that you otherwise would be able to. Because it seems that that's something that we all have the capacity to do, but if we're not introducing it at the right time or not introducing it at all, you're simply going to lose it. Yeah.
Getting back to the prescriptive side, you said through full range.
Yeah. Through different planes.
Yeah. Different directions, different planes, different exercises, different levels of complexity of the task. What else do you think is important? I mentioned obviously something like the density of exposure. What do you think is a reasonable amount of time to allocate in a week or a cycle of activity for youth to be involved in getting into, say, a resistance training modality? Yeah,
it doesn't have to be of high density to begin with, because again, this isn't becoming their main sport. This might be something as simple as starting at doing 2 or 3 times a week of half an hour. We're not talking about...
Yeah, or even, like, it's funny you say that, because even the thought that went through my mind is, like, even if you can allocate, 1 session per week, or part of their training, for their other sport once a week is, as you said, half an hour of resistance type stuff, even if it's, say, body weight training, they will get benefits from it.
Absolutely.
It's not going to be maximized, but that's not the point, as we've just been speaking about for the last 45 minutes. Like, that's not the point of it, is not to maximize. It's just
early specialization again. It's the same conversation that we had. Yeah, absolutely. Yeah, and actually one of the other things I was going to add just in terms of development is the important variable of velocity then too, and how we actually introduce higher velocity movements through the whole force velocity spectrum. Well, through the velocity spectrum from, slow controlled movements to stress shortening cycle movements.
With that, say for instance, often you might get a youth athlete or even general populace, and they're a bit uncoordinated, they're going through their growth spurt. If they can't control a movement at a low velocity, what are you saying to them? Are you saying, I need you to be able to do this first, or are you allowing them to go to the higher velocity task?
This brings up a question of how important is it for their movement to be perfect to begin with?
Well, when I say, it's obvious that they're uncoordinated. They're uncoordinated in both, for instance.
Yeah, look, I mean, the other thing I think about too is exposing someone to a task that they find difficult isn't a bad thing. Even if it doesn't look too coordinated or effective, doesn't mean that you should stop straight away. I think you need to give... I mean, for me, I see that as a really good learning opportunity. Like, one, from the thing of, all right, you're finding this frustrating, you're finding it difficult. Let's see how you develop strategies to deal with it. And I also think even too, just from the standpoint of some of the emotional reactions of like, oh, but I look really uncoordinated in front of all my mates. It's like, it's all right. Like, let's actually work through this. So, I mean, of course, you want to make sure that it is at a level that you think that they can still achieve a high competency of movement, literacy and quality within a short period of time, because one of the great things about kids is they're pretty good at picking up things quickly. But, I mean, that's also part of the value of exposing kids to resistance training, is to give them opportunities to develop new skills or expose them to movements that they may be unfamiliar with.
I'm just trying to think if there's anything else that we need to cover off on.
Well, I think the thing then to consider too is, and like there's actually a articles and literature out there that sort of give you some guidelines. So
Yeah.
it's probably worth looking at some
the
of
youth resistance position statements from the obviously it's from North America, but the National Strength and Conditioning Association, even the Australian Strength and Conditioning Association.
Yes, and it actually gives you some great guidelines, and sure, they're generic, but I mean, to be honest, when it comes to youth development, we probably can be a little bit more broad in our prescription because it is just about exposure. But so much of it is about making sure that eventually a child or a young adolescent can do a series of different movements with different parts of their body in different planes at different speeds to build up that overall what you would call movement literacy. And that really forms the foundation to then start to think about, okay, based on their training history, the child's age, their physical development, now we can start to expose them a little bit to some external resistance. And that can be in the form of doing a squat with a bar. It can be in the form of doing some weightlifting movements or derivatives with a bar. Could even be doing some accessory work and doing some bicep curls. There's actually nothing inherently wrong with that.
The boys will love that.
Oh, of course.
Do some bicep curls.
Yeah. But I think what's important to highlight here is, because even if it's, for instance, you're getting a youth to start when they're 14, 15, the starting point actually is similar, even though they may have gone through some of the physical changes that allow them to develop, say, more muscle mass because they've got the right hormonal environment. You still want to expose them and start them at the same level of, okay, can you do these basic movements? Can you actually do a push-up? Can you do these jumping tasks? Because they still need to have that foundation, and having that foundation will then allow them to make sure that when they start doing a squat with weight, there isn't any issues with their technique. They don't have issues with getting to the right depth. You have that foundation to go, right, great, we actually have an opportunity now to build up strength with a compound movement like this through a large range.
Jack, thank you very much for helping us discuss through that.
I hope it's helpful.
If anyone has any questions on, applying resistance training in that, younger population, feel free to reach out to us. I've really been enjoying actually exploring some of these topics of questions that we often get asked. So thank you for listening and always feel free to contact us.